Hello everybody, welcome back to the channel. Today I'm back with a medical video. So far I've been posting mainly just math videos on AOPS and other stuff, but obviously the channel's name is Math and Medicine with Andrew, so we have to include some sort of medicine inside my channel. So today it's going to be my first video that I'm actually going to cover medicine, and I'm excited to present to you Heart Failure Overview, Part 1. This is part of a series on cardiology, and we're mainly going to discuss the disease called heart failure, which is, in my opinion, a very important disease to discuss in detail. Today, we are going to discuss mainly the mechanism of heart failure. In like parts 2 or 3, I'm going to dive deeper into the diagnosis and treatment of it. But so far, we're just going to get like a hands-on understanding of how heart failure actually works. So let's start. First, what is heart failure exactly? Well, not to be misunderstood with another condition, heart failure is a condition in which your heart can't pump enough blood to meet the body's needs. That is the key definition over here. But that does not mean that your heart stops beating. Other than like other organ failures where the organ just completely shuts down, your heart still is functional. It's just not that great anymore. If your heart stops beating and goes flatline, that is a life-threatening condition known as cardiac arrest and requires immediate medical attention. But heart failure is just that your heart can't pump enough blood. So note that difference. And also, depending on like the location and mechanism of the heart failure, there is four types. There's mainly like left sided, right-sided, systolic, and diastolic heart failure. For the systolic and diastolic heart failure, we'll explain it later in parts 2 or 3. Today, we're just going to mainly focus on what happens, like generally in heart failure. Okay, so now it's time for me to bring up the normal anatomy of a heart. As you can see, when we learned in science class, blood from your veins, which is oxygen poor and carbon dioxide rich, flows through your veins into these two large veins called vena cavae, just like that, into your right atrium, which gets sent to the right ventricle, which pumps it through the pulmonary arteries to the lungs to pick up oxygen. And then in the lungs, the carbon dioxide gets expelled and the oxygen is brought in. So now we have oxygen rich blood returning from the lungs. They flow into your pulmonary veins, into your left atrium, into your left ventricle, before being ejected to the rest of the body. This is a normal blood flow through the heart. And just in a bit, you'll see how heart failure impacts this normal flow. Okay, so now, before that, we'll talk about the causes of heart failure. What causes the heart muscle to fail? Well, the most leading cause of heart failure is coronary artery disease. Basically, the small arteries that supply your heart with oxygen and nutrients are called coronary arteries. And when those coronary arteries get damaged, it is not a good thing. The heart is lacked of oxygen and nutrients, which causes it to be unable to work as efficiently as before. This is known as ischemia, which is basically the heart muscle weakening due to lack of oxygen. Another cause of heart failure is called cardiomyopathy. Cardiomyopathy is, in simple terms, cardiomuscular disease, cardiac muscular disease, or heart muscle problems. It's basically when the ventricular walls either are too thick, too dilated, or too, like, just too tight and too restrictive in order to pump blood efficiently. And that can also result in heart failure. Another cause of heart failure, this one is a less common cause, it's called endocarditis. It's basically when bacteria infect the most inner layer of your heart, called the endocardium. Basically, this also includes the heart valves, and it especially affects the heart valves as this bacteria can basically damage the heart valves and cause it to malfunction. And heart valves are basically the valves that control blood flow through your heart so that blood is able to efficiently flow through and also doesn't back up. If your heart valve is like can't open properly, it can cause blood to be restricted as it pumps through a heart valve. If your heart valve can't close properly, the blood will back up into your ventricles. And endocarditis basically damages your heart valve and causes all those nasty conditions to occur. And obviously, damaged heart valves means weakened heart muscle, which means heart failure. The next cause is arrhythmia. This is a fancy term. It just literally just means abnormal rhythms in the heart. You see, the heart has its own electrical conduction system where your heart sends signals to itself for it to beat and pump blood. That's called the cardiac conduction system. When this is malfunctioned, it can cause your atria or ventricles to contract abnormally, resulting in inadequate filling or contraction of blood, which is not good, as it can lead to heart failure in common types like atrial fibrillation. For the last cause of heart failure, it is congenital heart defects. These you cannot prevent. They're just basically birth defects. Basically, they're mostly genetic or at least gene linked. So it's basically a newborn baby with a deformed heart. This can usually manifest as holes between the walls of the ventricles or the atria that result mixing of oxygen rich in oxygen poor blood. And of course, here comes my favorite one, tetralogy of Fallot. This one is pretty serious actually, and we're not going to discuss it in great detail in today's video, probably in some other video that I'll make, but these are just basically congenital heart defects. Now, here is what happens when your left side of your heart fails. Again, remember, this is the right side of your heart, this is your left side of your heart. Heart failure can be divided as left and right side heart failure. In this case, your left side of your heart fails. What will happen? Also, I don't know why, but there isn't a pulmonary vein. I'll just quickly draw that in. So, let's say your left ventricle is especially weakened and damaged, right? What does that have to do, and how does that affect blood flow through the heart? So, I'm going to use kind of a metaphor here, if you guys won't mind. It's called the erythrocyte express. Sorry if this is kind of a TED Ed reference, but it will be interesting. So let's say your red blood cells are basically like buses taking oxygen and delivering them to your clients, which are basically the cells in your body. Well, you see, what is the heart? It helps pump these buses or add fuel to them so they can just basically go wherever they want. Well, that means that the heart is like a gas station where it just helps to fuel up all of these buses and make sure they're going where they're going. Let's say there are two main gas stations in the heart, representing both the left and right ventricle. So, when your left ventricle fails, that would cause basically a traffic jam, right? Like it fails and cars have to stop moving. And not only that, sometimes it cannot provide sufficient amounts of fuel for the red blood cells after the traffic jam, and that can cause them to go like halfway up a mountain or something, and then just go whoop, crashing all the way back down. Pretend that they don't have brakes. So basically, this causes like a whole backup of traffic inside on the highways or arteries and veins. So basically, that causes a whole traffic jam up on the highway in the blood vessels. And here is where we lead to today's main topic, congestion. Obviously, a lot of people you may have heard of congestive heart failure or CHF, but why isn't like it chronic heart failure or something else? Why congestion? Well, congestion in this metaphor just basically means traffic jam. And you know what happens in traffic jams? People get clogged up in this tiny space and they can't move, and they also can't go where they're going. This is what basically happens in heart failure. There is a lot of congestion. Let's say the erythrocytes are clogging up all of the pulmonary veins. Well, you know that blood not only contains red blood cells, but also contains other fluids, right? Like just fluids, like water, electrolytes, all that stuff. Well, pretend those are like cars on the highway. And obviously, the red blood cells are the most important part because they deliver oxygen and nutrients. So let's say in order to compensate for this situation, all of the cars have to back off from the highway and find somewhere to rest and sit so that the traffic would slightly soothen up a little. But obviously we're in the lungs because we're backing up inside the pulmonary veins into the lungs. Where else could you go? Now let's look at the small air sacs called alveoli where gas exchange occurs. So basically, your blood is like in these uh, small highways called capillaries, and they're trying to back up. Well, the only place you can back up over here is the alveoli. And let's say the alveoli are like bus stations. It's where oxygen gets off and onto the erythrocyte express, and when carbon dioxide gets off of the erythrocyte express and basically just gets expelled out of the body. That is what basically alveoli do. Well, let's say bus stations, right? They have to have some sort of parking lot where the buses can be parked. Let's say all of these small cars are just parking in like the wrong places and basically now the buses can't have anywhere to park. That basically just causes less gas exchange to occur. And that is mainly what happens in left-sided heart failure. Basically your Pulmonary system gets clogged up with blood, known as pulmonary hypertension right here. And your body compensates for that by basically taking the fluid out of the blood vessels into your lungs, which reduces the blood volume and thus reduces the pressure, which is known as edema, as fluid builds up in your lungs. Obviously, this is not great for breathing. Like, imagine all of this space right here just covered in fluid. Like, it's like having pneumonia, where fluid also accumulates in the lungs. But now imagine it just like persistent fluid buildup in the lungs. Like, pneumonia usually goes away, right? Well, imagine just having pneumonia for like the rest of your life. How would that feel? So that is what basically left-sided heart failure patients are experiencing, pulmonary edema. And now here is where things go even more farther. Let's say that that much congestion is like already very bad. And how could it get worse? Sometimes your body can't even compensate for all the traffic jamming up in the pulmonary vessels. So guess what? Now traffic is starting to back miles up. Like, it's like a long paralyzed snake that can't even move. And guess what? Now it's starting to clog up another gas station. And that is right. We're talking about the right ventricle. Basically, the blood starts to go back because of the congestion, and now it's starting to back up all the way into the pulmonary arteries and eventually into the right ventricle. This results in increased vascular resistance, which basically is increased blood pressure in the pulmonary arteries, and your right ventricle has to generate such force such that the pressure exceeds that of the pulmonary arteries. And how does the right ventricle have to do that? It has to generate more force, more forceful contractions in order to make sure the blood flows into your lungs. And this can cause your right ventricle to thicken so it can generate more force. But this is actually bad because then this can not only weakens the right ventricle over time, it can also make it not able to fill with blood properly. And that is what leads us to right-sided heart failure. And this is also known as cor pulmonale and is the leading cause of right-sided heart failure. Okay, now let's basically explore what happens when this condition arises and what symptoms will manifest. So let's look over here. Now you have your right ventricle, which is already weakened because of all the traffic jamming. Now guess what? The blood is trying to back up, and in this case, it has nowhere to back up but the systemic circulation. And this is where things really get bad because the lungs are only like a regional section of the body. But now the systemic circulation includes all of that from your brain to your toes. That means that the symptoms will be much more systemic and widespread. So, congestion happens all the way up from your head to your toes. And again, it's that keyword, edema. Let's see. So, first, from your head to your toe, the first area affected is your neck. This is one of the most visual signs of heart failure. Basically, the big veins in your neck are called jugular veins. and they can get congestion as basically they swell up due to the amount of blood, the blood volume that has been pooled inside there. So now a lot of blood is pooling in the jugular veins and cause them to distend or basically enlarge and bulge so that it actually is visible right here in this patient. Another sign is that when you go lower into your abdomen, a lot of things can arise. First of all, you get this very disturbing picture of something called a nutmeg liver. So basically, what is a nutmeg liver? Basically, those, all of the blood pooling in the systemic circulation starts to back up into the hepatic veins, which causes distension of those small hepatic veins and lobules. This will result in the darker red color of the small hepatic venules compared to the paler liver cells, and that is known as hepatic congestion. It can also cause your liver to swell and become enlarged, meanwhile also reducing liver function. And in case you didn't know, a grated nutmeg will look something like this. I obviously am not that much great of a drawer, but it'll like share some patterns where there'd be like white spots and then dark spots, which is kind of like this. Well, it's just kind of. The main thing disturbing about this is that it has so many dots, and those with like that phobia where you can't, when you see so many holes inside, so many clustered holes inside an object, it really throws you off. And that is basically what is happening right now. Your liver basically gets packed with all of these small little dots, and that is absolutely disgusting. Also, now looking back at the abdomen, you have something called ascites, which is basically, you can say it as a fat belly, but also not really fat, because what is accumulating inside that is not fat. So this is basically all the fluid that's trying to accumulate inside your peritoneal and mesenteric cavities, which cause it to expand, and you basically have bloating. And a lot of people will see this as you just basically gaining a fat belly, which is not the case. And it's also not very good to look at, by the way. Going down into the lower extremities, we have something called pitting edema, which is basically just your legs swell up with fluid, and this results in a pit when you press hard down on them. It's also a very visual sign of heart failure. Lastly, we're going to go to the symptoms of heart failure. So, the first one is fatigue, right? This is obvious. No matter what, cardiac output is reduced and your client cells can't receive enough of oxygen. Then you also have shortness of breath, which is also known because all of that fluid buildup in your lungs can make it difficult to breathe. Swelling, again, that's edema, which is just fluid buildup. Now we have something called nocturia. Basically, your kidney veins, called renal veins, I'm pretty sure, get clogged up, and that can cause inadequate blood circulation throughout the body, and your kidneys can't filter all of that blood. But then when you lie down, gravity would redistribute that fluid, and now your kidneys can filter blood properly now. And that results in you have to go to the bathroom like 7 times at night just to go to the potty. And that is not a pleasant sensation. It can result in disrupted sleep patterns and is not good. And by the way, nocturia means noctur, which just means night, and uria just means peeing. So just frequent peeing at night. Finally, we have a cough that worsens when you lie down, like when you sleep. Well, this is basically, you see in pulmonary edema, mainly the fluid collects in your lower lung cavities due to gravity. But now when you lie down, that fluid starts to go upwards due to redistribution. And that is not a pleasant sensation that can make you cough even more. And that is it for today, guys. Thank you for watching this video. See you guys next time.